So now let's go back to where we started with that throwing athlete, and let's talk about the type of conditions that that they would have that are not inclusive of a tear to the rotator cuff. For example, bursitis is a common thing that we see in the office. Probably the single most common non-surgical disease that we see in a shoulder is bursitis. And it's easily treated, and typically it shows up with a patient having trouble to sleep on that side or reach their hand up over their head. Now that may be a sign of a more significant pathology, but often it's just the simple bursitis, and that can be managed. Tell us how you treat it.
And so let's just talk about what is bursa, and itis meaning inflammation of the bursa, and it just so happens nature has placed, if you want even, I like to explain this to my patients, think of it like a air ball or a plastic air between any bones. If we didn't have that, we'd be grinding like trees. So we kind of slide one joint over the other. In this case, we're talking about the ball and socket and the other joints we mentioned. But basically, when that air ball or the air pocket where the sliding mechanism goes bad, itis, inflammation, fluid, anger, redness, and where the grinding starts, we call it bursitis. Now, bursitis shouldn't happen by itself. There's probably some reason behind it. And in this case, if you're talking about overhead athletes or throwing athletes or athletes who are doing a lot of upper body exercises, sometimes they overdo it more than the body can handle, and the reaction to their whatever injury is bursitis. So we see the end product of their injury by calling it bursitis, but then that's where we dig in a little bit deeper to figure out what is the reason for the bursitis.